Welcome to this clinical guide on ADHD medication monitoring. You're taking medication for ADHD. Understanding whether your current dose provides optimal therapeutic benefit requires systematic evaluation. Many patients find this assessment challenging without clear clinical markers. This guide explains the specific indicators of effective ADHD treatment. You'll learn to recognize when your medication works correctly and when to consult your GP for dose adjustment. Let's address a common misconception immediately. Finding your optimal ADHD medication dose isn't achieved in a single appointment. The process requires careful titration over multiple consultations. Even established doses that have worked effectively for years may require adjustment. Why do stable doses need review? Your brain chemistry changes with age. Life circumstances affect medication response. Weight fluctuations alter drug metabolism. Stress impacts neurotransmitter function. These factors mean your therapeutic requirements evolve over time. Stress, significant life changes, and hormonal fluctuations can disrupt your medication's effectiveness. When you begin ADHD treatment, your GP will prescribe a very low initial dose. This is standard medical practice. The purpose is to monitor your body's response and ensure your safety. This cautious approach means your starting dose will likely be insufficient for symptom control. Several indicators suggest your dose needs adjustment. Your core ADHD symptoms may persist. These include restlessness, difficulty concentrating, and impulsivity. You might find these symptoms continue despite taking your medication regularly. Another sign is minimal therapeutic effect. Some patients only recognize their medication is working when they accidentally miss a dose and experience symptom return. This indicates the current dose provides subtle benefits that become apparent only through their absence. You may notice that procrastination remains a significant problem. Your emotional responses might continue to be overwhelming or difficult to control. If this describes your experience, please don't feel discouraged about your treatment. This response actually indicates something positive. The medication is having an effect. It's simply not providing adequate symptom control yet. This doesn't represent a treatment failure. Consider it the first phase of finding your optimal dose. There's a specific objective measure you can monitor yourself. Short-acting dexamphetamine provides a useful example. This formulation typically maintains therapeutic effects for 3 to 4 hours. If you consistently notice your symptoms returning after only 2 hours, this indicates your current dose isn't sufficient. These objective measurements provide evidence you can present to your GP. The data clearly indicates your current dose may be insufficient for optimal symptom control. Let's examine the opposite scenario. What indicators suggest your medication dose exceeds therapeutic requirements? The clinical objective remains identifying the minimum effective dose. Many patients inadvertently exceed their optimal dosage range when they don't recognize the warning signs their body provides. Emotional blunting represents one of the most significant indicators of excessive dosing. You might notice a robotic quality to your emotional responses. Your feelings seem muted or absent. Family members or close friends often observe these changes before you do. They might comment that you seem different, or that your typical sense of emotional flattening is a significant indicator that your medication dose may be too high. When patients report feeling emotionally flat or detached, this requires immediate clinical attention. Emotional blunting refers to a reduced capacity to experience normal emotional responses. Patients describe feeling emotionally detached or less responsive to situations that would normally evoke feelings. Some compare it to having their personality dampened or muted. This side effect can significantly impact quality of life and relationships. ADHD medication should improve executive function and attention, without suppressing your emotional range or core personality. The therapeutic goal is symptom management, not emotional suppression. If you're experiencing emotional blunting, this indicates your current dose exceeds your optimal therapeutic window. You must discuss these symptoms with your GP promptly. Dose adjustment or medication change may be necessary. Beyond emotional flattening, there are additional warning signs that indicate your dose requires review. When you find yourself hyperfocusing on irrelevant details while neglecting important tasks, this indicates a potential dosing issue. Your concentration becomes narrow and rigid rather than flexible and productive. Physical symptoms provide important diagnostic information. You might experience tremors similar to excessive caffeine consumption. Jaw clenching often occurs without conscious awareness. Complete appetite suppression represents another significant indicator that your medication requires adjustment. Heart rate monitoring remains a critical safety parameter. While stimulant medications typically cause mild cardiovascular changes, a resting heart rate consistently above 100 beats per minute constitutes a medical concern. This measurement requires immediate attention. Contact your GP practice immediately if you observe this cardiac response. Do not postpone assessment until your scheduled review appointment. Cardiovascular effects from ADHD medications demand prompt clinical evaluation and potential dose reduction. When you've tried various dosage adjustments without success, it's important to reassess your treatment approach. If you're experiencing minimal benefits or persistent side effects regardless of the dose, the issue may not be the dosage at all. The medication itself might not be suitable for your specific neurochemistry. This is a critical concept for patients to understand. In Australia, the Therapeutic Goods Administration has approved stimulant medications that belong to 2 distinct pharmacological families. The first group consists of amphetamine-based medications, including Vyvanse and dexamphetamine. The second group comprises methylphenidate-based medications, such as Ritalin and Concerta. These two medication classes affect brain chemistry through different mechanisms of action. Each individual's neurological response can vary significantly between these classes. Some patients respond exceptionally well to amphetamines, but poorly to methylphenidate, while others experience the opposite pattern. A negative response to one medication class provides no predictive value regarding your potential response to the other class. When should you consider changing your medication? There are several clear indicators that suggest a medication change might be necessary. If you have completed the full titration process and tried multiple different doses without experiencing meaningful improvement, this indicates the current medication may not be suitable for you. Another important sign is persistent side effects. If you continue to experience anxiety or insomnia, regardless of dose adjustments, even at the lowest therapeutic levels, your body may not be responding well to this particular medication. Pay particular attention to your mood throughout the day. If you experience severe mood crashes or emotional dysregulation when your medication wears off, this represents a significant concern that requires medical attention. These rebound effects can be more than just uncomfortable. They can significantly impact your daily functioning and quality of life. Each of these situations warrants a thorough discussion with your GP about transitioning to a different medication class. Let me provide you with a structured approach to move forward with your treatment. The term I mentioned earlier is titration. This is the formal medical term for the dose adjustment process. It's important to understand that this isn't random experimentation. This is a structured clinical protocol that you undertake with your GP, based on your documented responses. Understanding that titration follows established medical guidelines can reduce anxiety about the adjustment period. The process relies on systematic observation and clear communication between you and your doctor. Here's your 3-step action plan for effective titration. First, track your medication response daily. Document the benefits you experience, any side effects that occur, and how long the medication's effects last each day. Second, categorize your observations using the clinical framework we've discussed. Apply proper terminology to describe your symptoms and responses. This structured approach ensures your GP receives the precise information needed to optimize your treatment. The third step involves booking a review appointment. Schedule a consultation with your GP to discuss your medication tracking notes. Bringing documented observations creates a more focused and productive clinical discussion. Your preparation helps your doctor make informed decisions about your treatment. I need to emphasize a critical safety point. Never adjust your medication dose without medical supervision. ADHD medications require careful clinical monitoring. Self-adjustment can lead to serious complications or treatment failure. Dose modifications must follow proper medical protocols. Your GP needs to assess multiple factors before making any changes. This includes reviewing side effects, therapeutic response, and potential drug interactions. Here's the key message to remember. Medication adjustments are a standard part of ADHD treatment. Most patients require dose modifications during their treatment journey. This represents normal clinical progress, not treatment failure. Your brain chemistry is unique. Finding the optimal dose takes time and professional guidance. Actually, this indicates something quite positive. It demonstrates that you're taking an active role in managing your treatment and working to optimize your outcomes. Let me pose an important question for you to consider. You now understand how to recognize these clinical signs. Which specific symptoms or concerns will you raise during your next medication review with your GP? You possess the clinical knowledge needed to participate effectively in your treatment decisions. Consider which particular issues you should discuss with your doctor. What specific adjustments might help you achieve optimal symptom control? Think about your daily functioning. Which areas need improvement? Your observations about medication effectiveness and any side effects are valuable clinical information that will guide your GP in making appropriate dose adjustments.